Hi, I'm Dr. Warren Kennedy. I'm from TasIVF. I'm a fertility specialist there. Today I'd like to talk to you about reproductive genetic carrier screening. Everyone has got 23 pairs of chromosomes, and on those chromosomes there are thousands of genes. Genes carry the packets of information that make our bodies run. Everyone has 2 copies of every gene. There are some genetic conditions where both copies have to be abnormal before you have a problem. They're called recessive genetic issues. You can get tested for hundreds of these recessive genetic issues. That's very expensive. At TasIVF, we recommend that you get tested for the 3 most common recessive genetic conditions, and those are cystic fibrosis, spinal muscular atrophy, and Fragile X. Cystic fibrosis, I think everyone's aware of. That gives you problems with your lungs, problems with your pancreas and your digestion. Spinal muscular atrophy is a condition that affects nerves and muscles. If a baby has the more severe form of spinal muscular atrophy, they don't live beyond the age of 2. Fragile X is a condition that is the most common reason for intellectual disability, developmental delay, and autism-like behaviour. In order to have a problem with a recessive genetic condition, you have to have 2 abnormal copies of the gene. We recommend that all couples have screening for recessive genetic conditions. That's because they're so common. The way that the testing works for recessive genetic conditions is that initially the mother gets tested. If she's negative, that's where the testing ends. If she's negative, can she still have one of these conditions and pass it on to her baby? Yes, it's possible, but it's very uncommon. It's where they're carrying a rare mutation of the gene that isn't actually picked up in the test. If she tests positive, then her partner gets tested. Again, if he's negative, that's where the testing ends. If he's positive, we then handball you to a genetics counsellor to get some further information. If we're aware of these recessive genetic conditions, we can do testing of embryos before they're implanted back into the uterus during the IVF process. Non-invasive prenatal testing is quite different to reproductive genetic carrier screening. In non-invasive prenatal testing, this is performed around about 11 weeks gestation, and it's based on the fact that in the mother's blood at that time there is lots of DNA floating around. Most of it comes from the mother. It comes from cells that have died. They burst open and release their DNA. Some of the DNA comes from the placenta, and in the vast majority of cases, the placental DNA is exactly the same as the baby's DNA. Using very complex, expensive machines, they can look at all of that DNA and give a result with high certainty as to whether the baby is carrying Down syndrome or other chromosomal abnormalities. It will pick up more than 99% of Down syndrome babies. This is very different from the reproductive genetic carrier screening, where we're looking for the genes in the mother and the potential father, rather than looking at the DNA of the baby. If you're wondering whether you should get testing for reproductive genetic conditions, you can talk to your fertility specialist, or better still, go see your GP and perhaps organise some testing before you even come to the infertility clinic. Thanks for watching Fertile Minds. Feel free to subscribe.